Imagine if every medical scan you've ever had didn't just show a picture, but told a far deeper story, revealing secrets the human eye couldn't possibly see. Today, we're diving into how medical images are transforming from static visuals into powerful data, really changing how we diagnose, treat, and even predict outcomes. We're talking injuries, complex cancers, you name it. Our mission in this deep dive is to explore this cutting-edge intersection of radiomics and deep learning. We'll look at musculoskeletal stuff, colorectal cancer, brain imaging, really helping you get informed on this fast-moving field. Okay, let's unpack this.
Precisely. And at its core, radiomics is about converting those radiological images, MRIs, CT scans, into this high-dimensional, meanable data.
Meanable data, so not just looking at it.
Exactly. Think of it less like a flat photo and more like computationally extracting thousands of incredibly subtle hidden details.
Hidden details. Like what?
Well, tiny variations in texture, precise shapes, how bright or dark certain areas are, way beyond what any human eye could consistently perceive. These hidden, higher-order features, they're then turned into these massive data sets.
Okay, so you get all this data, these hidden patterns, and then...
And that's where deep learning steps in. These really powerful machine learning algorithms process that immense amount of radiomic data. They're trained to learn from the patterns, identifying crucial markers that help not just with, say, basic diagnosis, but also more nuanced classification. Telling different types or grades of disease apart.
Right. So where are we seeing this making a real difference right now? Like in musculoskeletal radiology, how's it changing things there?
Oh, absolutely. Great question. In areas like knee injuries, for instance, we're seeing deep learning algorithms spot ACL tears with accuracy that sometimes matches or even outperforms human radiologists.
Really? Outperformed?
Yeah, in some studies. And maybe even more impressively, differentiating between benign and malignant soft tissue tumors.
Right.
We've seen figures like 95% accuracy reported compared to maybe 84% for radiologists in those same comparisons. It's a potential game changer for speed and, precision.
Wow, 95%. That's a big jump.
Okay, from knees to something even more critical cancer.
Yeah.
How is this tech impacting, say, colorectal cancer that's spread to the liver?
Yeah, colorectal cancer liver metastases, or CRLM. What's fascinating here is how radiomics can go beyond just spotting the obvious tumor. It can analyze the texture of what looks like healthy liver tissue around it and find tiny hidden metastases that might otherwise be missed. And even more, it can sometimes differentiate between distinct tumor growth patterns.
Growth patterns, meaning how it's spreading.
Exactly. Like, is it aggressively invading the surrounding tissue, or is it sort of pushing it aside?
Right.
That difference is actually critical for predicting how that specific tumor will respond to treatment. It helps guide doctors to the best therapy, potentially much faster. Okay, that makes sense. And what about brain tumors, like gliomas? I hear these tools are pretty crucial there, too.
Indeed. They're really vital for distinguishing the aggressive, high-grade gliomas from the lower-grade ones. But what's, I think, really impressive is their ability to help tell the difference between a tumor that's actually growing back after treatment and effects that just look like a tumor, like radiation damage.
So avoiding unnecessary follow-up procedures.
Potentially, yes. It can achieve up to 90% accuracy in some cases for that distinction, possibly preventing risky invasive biopsies.
That brings it to something maybe even deeper. What if your scan could actually hint at your tumor's genetic makeup? Is that possible?
That's precisely where radiogenomics comes in. It's this amazing field linking those imaging features we talked about, the textures, the shapes directly to gene expressions and mutations within the tumor.
So the scan reflects the genes.
In a way, yes. It gives insights that previously you could only get through an invasive biopsy. For example, in colorectal cancer, models are being developed using radiomics to non-invasively predict key genetic mutations. Things like KRAS, NROD, DRES, or something called microsatellite instability.
And knowing those mutations is important
because it tells doctors which targeted therapies are most likely to work for that specific patient's tumor. It guides personalized treatment, saving crucial time, avoiding treatments that won't be effective. Similarly, for gliomas, imaging might predict the IDH1 mutation status, which heavily impacts prognosis and the treatment path.
So really drilling down, what does this all mean for you, the listener, potentially facing a medical scam?
Well, the promise is more precise, earlier detection, and truly personalized treatment strategies. We're extracting unprecedented levels of detail from images that we just couldn't see before. Ultimately, it should lead to vastly improved patient care.
Right, but it's not quite standard practice everywhere yet, is it?
No, absolutely. It's important to stress that while it's incredibly promising, These fields are, relatively speaking, still in their infancy.
Yeah.
We definitely need more standardized, large-scale studies across different hospitals and patient groups.
To make sure the results hold up.
Exactly. To ensure reproducibility and generalizability before it can be widely adopted in everyday clinical practice. We need to move from cool research concepts to reliable tools safely and effectively.
Okay, so radiomics and deep learning are genuinely transforming medical imaging, taking it from a subjective look to quantitative, actionable insights. It feels like we're right on the cusp of a new era in personalized medicine.
I think so. Imagine a future where your medical scan tells a complete, personalized story about your health, guiding every single treatment decision before a needle even needs to touch you. That's the goal we're working towards.